It happened again. A couple of days ago, Benjamin Mock, an orthopedic surgeon from Memphis, Tennessee, was shot by a patient. Now, I'm a urologic surgeon. I live in Memphis, but I didn't know Dr. Mock personally. I know it's a tight medical community, and the loss of someone like Dr. Mock will be devastating not only to his family, his coworkers, but to the medical community at large. You might remember last year there was an orthopedic surgeon in Oklahoma City who was also killed by a patient. And this trend of violence against healthcare workers is not only a big problem, but it seems to be getting worse in our country. And you have to believe that this is not only a stressor for physicians and healthcare workers in our country, but also a big contributor to burnout. Because now, as a doctor, when you have a patient that's angry at you, you have to wonder somewhere in the back of your mind, is this patient going to come back with a gun and kill me? Now, I don't know what the answers are here because we live in a country where there are literally more guns than people. And this kind of violence against healthcare workers happens in blue states and it also happens in red states. And there's only so much security that you can have in your hospital or your clinic before it feels like you're practicing in a prison. This is a really complex issue, and I don't know if there's one solution that will fix this. Now, certainly we have to discuss common sense gun control laws in our country, but also there's something going on here in terms of patient empowerment. Why do we get to a point in our country where some patients just feel so disempowered that they feel that the only option they have is to bring a firearm and use it against their healthcare worker or physician? Regardless, this is a huge loss and tragedy. My thoughts and prayers are with Dr. Mock's family and the greater medical community in Memphis. I'm Dan, the No Name Doctor. I'm a urologic surgeon and real estate investor. Follow for more.